How do I know if I have latent TB or active TB? Imagine feeling perfectly fine but still carrying bacteria in your body. That's what happens with latent tuberculosis infection. You have the bacteria but they are inactive, so you don't feel sick and cannot spread it to others. It's like having a dormant virus that isn't causing any trouble. People with latent TB often find out through a skin test or a blood test because they show a positive result even without symptoms. Usually their chest X-ray looks normal, and they feel healthy. Active tuberculosis, on the other hand, is a different story. When TB bacteria become active, they start multiplying and causing symptoms. You might develop a cough that lasts more than 3 weeks, sometimes with mucus or blood. You could experience unexplained weight loss, loss of appetite, night sweats, fever, chills, or fatigue. Some people also feel chest pain or discomfort. If the infection spreads beyond the lungs, symptoms can vary depending on the affected organs, like swollen glands, back pain, headaches, or confusion. The key difference is contagiousness. Latent TB is not contagious because the bacteria are inactive. You can't spread it through coughing or talking. But active TB, especially if it's in your lungs or throat, can be passed to others through coughs or sneezes. That's why active TB needs prompt treatment to prevent spreading. Diagnosing latent TB involves a simple skin test called the tuberculin skin test or a blood test called an interferon gamma releases assay. If these tests are positive but you have no symptoms and your chest X-ray looks normal, you likely have latent TB. To diagnose active TB, doctors will do a chest X-ray, examine your symptoms, and test sputum samples to find bacteria. Treatment for latent TB usually involves taking antibiotics for several months to prevent it from becoming active. Active TB requires a longer course of multiple antibiotics, typically lasting at least 6 months, to fully cure the infection and prevent spread. If you notice symptoms like a persistent cough, weight loss, night sweats, or fever, it's important to see a healthcare professional promptly. They can evaluate your condition with appropriate tests and guide you on the best treatment options. Remember, even if you feel healthy, latent TB can become active if your immune system weakens, so medical evaluation is essential. In summary, the presence or absence of symptoms, whether the bacteria are active or dormant, and diagnostic test results help distinguish latent from active TB. Latent TB is silent and non-infectious, while active TB causes illness and can spread to others. Always consult a healthcare provider for personalized advice and testing if you suspect TB.